The MACPRO Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MACPRO assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.
Next slide, please. So here we have the updates to the Maternal and Infant Health Initiative contraceptive care measures. We've updated the Maternal and Infant Health Initiative resource manual for the contraceptive care all women ages 15 to 44, or the CCW measure. These updates included removing ICD-9 and ICD-10 codes from the manual and creating a value set directory for these codes, and we added links to the code tables into the specifications. We also clarified that the measure does not have a look-back period, and we updated the 3 appendices in the resource manual. These include the summary of changes to the maternal and infant health quality measures, technical specifications, the data quality checklist for states, and the guides to interpreting the rates for contraceptive care measures. And as both Allison and Colleen mentioned, the contraceptive care postpartum women measures will be reported as part of the child and adult course sets beginning in FFY 2017. So the CCP-CH measure will be reported in the child report, and the CCP-AD measure will be reported in the adult report. Next slide, please. And on this side, we've listed the resources for FFY 2017 Maternal and Infant Health Initiative measure reporting. So first, we have the updated FFY 2017 resource manual and technical specifications. We have a link to the SAS code to calculate the CCW measure, and then we've also provided the link for additional TA resources on Medicaid.gov. And now I'll turn it back over to Allison, Colleen, and Rosemary to discuss data quality. Next slide.
Thank you, Ella. Now we'll provide an overview of CMS's focus on data quality. Next slide, please. First, we'd like to provide a recap of the state data quality outreach process for FFY 2016. As many of you know, we conducted systematic data quality outreach to states that reported core set data using the Seek More Information, or SMI, function in MACPRO. We want to thank all of the states that responded to our questions and provided informative clarifications and feedback. There are many reasons that we reach out to states during the data quality review process, but I want to highlight some of the most common ones. First, if we see something that looks like a potential data entry or calculation error, we usually ask the state to confirm that the information entered was correct or to correct the data. Sometimes we also ask for clarification about something that was entered into one of the key data fields or notes that was unexpected. For example, this includes rates that are notable outliers from rates that are reported by other states, or for example, if a rate of 0 was reported. We would also ask about rates or denominators that don't seem consistent with the reported methodology. Next, we often request specific information about the delivery system or populations that are included in the measures. So the more information that states can provide about these topics when reporting in MACPRO, the better. Finally, if we notice large changes in rates or denominators from what the state reported the previous year, we usually ask about that as well. I want to emphasize that if you receive questions from us during the SMI process, that does not mean that your state did anything wrong. We ask clarifying questions to nearly every state about some aspect of their core set reporting. The SMI process helps us to gain a more comprehensive understanding of the nuances of each state's data, and it also enhances the accuracy of the data reported. This process can also help to increase the number of measures reported, as sometimes states are able to report additional measures with more time or technical assistance. Again, we want to thank all states for the timely, informative feedback that they provided during the data quality outreach process for FFY 2016. Next slide, please.
So I'm going to talk a little bit about CMS's focus on data quality for this coming reporting cycle for FFY 2017. MACPRO contains some built-in data quality checks that helps states to facilitate data completeness, accuracy, consistency, and documentation. So for example, you might notice when you're reporting that a red validation error will show up as a border around a field. Just so, for example, one example might be if you report a numerator that's larger than a denominator for many measures, this will show up as a validation error. So we want to encourage you to look at these validation errors as you're reporting. This year, you'll find several new validation checks. For example, for the immunizations for adolescents measured in the child core set and for the antidepressant medication management measure in the adult core set, there's a new validation check to make sure that all the denominators within the same age group have the same denominator. And so we encourage you to review these error flags when entering and saving your data with the hope that this improves data quality and helps you catch these issues, the types of issues that we tend to raise during the data quality outreach. We hope that these will help you catch them earlier on. And as in FFY 2016, the SMI function in MACPRO will be used to conduct data quality outreach. And some areas of focus that we plan to reach out about include making sure that states are reporting accurate start and end dates. And as a reminder, you can refer to the measurement period table listed on an earlier slide to help you figure out which start and end date field should be entered into MACPRO as long as you follow the measure specifications. We'll also be focusing on consistency of reporting measures calculated using the hybrid method. So for example, what number you should report in the sample size field versus what you should be reporting in the measure eligible population field. We'll be focusing on how to calculate state level rates when you have data from multiple reporting units. So for example, several states receive data from multiple MCOs, and some MCOs might use administrative methods while some MCOs use hybrid methods to report. So we'll be focusing on making sure states are calculating their state level rates consistently when that happens. We also want to focus on documentation of the populations that are included and excluded from the data. So for example, if your state doesn't include fee-for-service in your state level rate, it's important for us to understand that, or it's also helpful for us to understand if for a certain measure, for some reason, there's a proportion of the population that's eligible for the measure who is not included. And then finally, we ask that you record any deviations from the core set specifications whenever possible, including if you deviate from the age group, from the data sources, or from the general methodology for calculating the measure. And I'm going to pass it over to Rosemary now to talk a little bit more detail about some of these areas that we're going to focus on this year. Next slide, please.
Okay, so we're going to go through in the next few slides a little bit more detail of some of the items that Allison and Colleen talked about. And the first section here is just talking about the focus on data completeness. And all of these slides in this section have what we're calling tips for reporting based on things we've seen in the data in MACPRO in previous years, or based on questions we've gotten from states about areas of MACPRO that they found challenging to figure out or how to fit to their state's data. So this slide summarizes some of the key aspects of what CMS is looking for in terms of data completeness, which is a cornerstone of high-quality data. So CMS's goal is that states report data that are as complete as possible for each measure, ideally reporting all rates in the measure and including all eligible populations in the state's Medicaid and CHIP programs. At the same time, CMS recognizes that states may not be able to achieve this goal for one or more measures. So in cases where you know your state's data will be incomplete in some way, so for example, missing a subpopulation of beneficiaries or not able to report a rate within a measure, CMS just asks that you please provide detailed information in MACPRO to describe the missing data and populations, so that CMS can document them, and also so that they can understand any challenges your state faced in calculating and reporting the measure. On the slide, we've listed some tips for you to reference during reporting to help ensure that your reporting is complete. And in particular, there's just another reminder of how helpful it is when you use the population, deviations, and additional notes fields in MACPRO to really describe your state's data. Next slide, please. So one area where we see inconsistencies in reporting across states and where we've received a lot of questions from states is how to report denominators and methodology for measures that were calculated using the hybrid method. So the table on this slide shows the information that CMS would like to collect for all of these measures that are based on hybrid data in the first column. Then the second column indicates how your state can provide the information in MACPRO. So for example, CMS would like to know both the number of individuals included in the sample medical record review, called the sample size here, as well as the size of the full beneficiary population that is represented by the sample. It's called the measure eligible population in MACPRO. So those items are both listed in the first column, and then the second column indicates where the information should be reported in MACPRO. So if you have the sample size used to calculate your measure, you can report that information in the denominator field. And then there's also a separate what is the sample size field. And then in the measure eligible population can go in the what is the measure eligible population field. Just a note that if you are combining data across multiple reporting units, so say you have 3 MCOs and you want to sum their samples and put that in the sample size field, that's perfectly fine. Just anything you can do in the additional notes section to explain what you've done is really helpful. In addition, the table at the bottom explains what to do if your state can't report some of the requested information, if you don't have the sample sizes, if you don't have the measure eligible population. And again, if you don't have it, CMS understands that sometimes this data is not available, but ask that you do please provide any context you can about the challenges your state faced in getting it. So for extra reference, we're not going to go through it today, but if you download the slide deck, there's another appendix example that walks through step-by-step how to calculate and report a state-level rate using hybrid method data when you're combining across multiple reporting units. Next slide. So we also want to highlight some of the data fields in MACPRO that collect information about the delivery system population included and also excluded from your state's data. So overall, there are 2 types of MACPRO fields that collect information on delivery systems. This slide focuses on the first type, the delivery system fields that are on the admin screen. And you'll see this in the demo later. It's that first landing page you see when you open your state's report. So in this section, CMS asks that you report the percentage of children or adults in your state who are covered by each of the following delivery systems: fee-for-service, primary care case management, managed care, or other. And this section should provide a big picture overview of service delivery in your state. So overall, in your state, what percentage of Medicaid or CHIP enrolled individuals are covered by each of the delivery systems? So this section should include all the Medicaid CHIP beneficiaries for the designated age group, even if your state may not be able to actually include them in your core set measure data. Another tip for reporting this is to please note that each column should sum to 100%. So in the example on the slide, you can see that the state entered that 25% of their Medicaid children under 21 are fee-for-service, 5% are in PCCM, and the remaining 70% are in managed care. So this sums up to 100%, representing all the Medicaid children under age 21 in the state. And also just a reminder that this section has to be filled out or you will not be able to complete and submit your MACPRO report. Next slide. So this slide focuses on the other type of delivery system fields in MACPRO. These are the fields that appear in each measure, and they collect information about the completeness of data for each delivery system for that measure. So these are the fields where your state can indicate that a population was excluded from the data. And this slide walks through how to complete these fields in MACPRO. So first, you'll select each delivery system that your state uses with the checkboxes next to each program in MACPRO. So if your state covers individuals using both fee-for-service and managed care, you would select both checkboxes in MACPRO. Then, for each delivery system that you selected, you report the percentage of that delivery system that is included in the data. So just note, CMS is looking for a general estimate here, and we don't want people to overly stress about getting the exact perfect percentage for each measure. It's just a general estimate of, are all of your fee-for-service children included, are none of them included, are half of them, you know, a general estimate is the goal here. And then the table gives a couple of examples for different states on filling out the fields. The one thing to highlight as you're looking at it, you'll see that these fields actually don't sum to 100% because the denominator for each percentage is the population in that delivery system. So you can have all of your fee-for-service children 100% and all of your managed care children another 100%. They're actually independent percentages. Next slide, please. Okay, this slide, we're going to focus on two other aspects of data quality, which are accurate and consistent data. So in other words, CMS is looking to ensure that the data reported in MACPRO accurately reflect your state's performance and that the data reported by your state are consistent across and within measures and over time. So the slide includes some tips for items that sometimes come up when we review data reported in MACPRO. And one thing we want to highlight in particular is that MACPRO works differently depending on your method for calculating a measure. So if you indicate in MACPRO that the measure was calculated using administrative data only, MACPRO will auto-calculate the rate based on the numerator and denominator you reported. And we just want to put out a reminder to please check that these auto-calculated rates are correct. It can be very easy to miss that the rate is incorrect because of a small data entry error in either the numerator or the denominator. Now, if you report that the measure was calculated using the hybrid method or a mix of administrative and hybrid methods, the system will not auto-calculate the rate, and you will calculate and manually enter the numerator, denominator, and rate in MACPRO. As Allison mentioned, another thing that may come up in data quality reviews is when we notice inconsistencies within or across measures. So, for example, if the measure eligible population for one measure seems unusually large or small compared to populations reported for other measures, that can trigger questions about the reported denominators. Or for measures where, based on core set specifications, one rate in a measure by definition should always be larger, inconsistencies can trigger concerns as well. So, for example, in the follow-up after hospitalization for mental illness measure, the 30-day rate should always be greater than or equal to the 7-day rate, and the denominator should be the same for both rates. When we see this isn't the case, we may follow up to clarify your state's reporting. If you're interested in some more of these measure-specific checks that we use when we're reviewing the data, as Alison mentioned, you can look at the data quality checklists that are available for the child-adult core sets. And these checklists list a lot of the checks that we look for in our reviews, and they can be a really great resource as you're reviewing your state's data. Next slide, please. Okay, this slide is a lot of words. It's another plea to document the data you're reporting in as much detail as possible. In particular, here, the tips we highlight documenting any deviations from measure specifications. And when you're reporting deviations, you want to know how you deviated, and then also, in particular, how your method differed from the core set, and to the extent you know what you think the implications are of the deviation. And also, please look at any changes in your state's data from previous years, and if you know the reason or you've checked it out and you think you have additional context you can provide, we also really encourage you to provide that information as well. Next slide. Okay, one aspect of core set reporting that's already come up a few times and it's been challenging to document consistently across states is the measurement period. or the time period that was used to calculate the measure. Now, for many measures, the measurement period for FFY 2017 reporting is calendar year 2016. But as many of you know, it's been particularly challenging to pinpoint the exact measurement period for a lot of measures because of the complexity of the specifications and because the measurement period for the denominator, the numerator, the continuous enrollment period within a measure can focus on slightly different time periods. So to facilitate consistency across states and to identify states where data may reflect different periods of performance from other states, CMS asks that states use the denominator measurement period to fill the start and end date fields in MACPRO. For measures that include prior review periods and look-back periods, even after you've identified your denominator measure eligible population, just please do not include those look-back periods in the date range. CMS recognizes that because of these prior review periods and the look-back periods, even identifying the denominator measurement period can be tricky. So each year, there is a measurement period table on Medicaid.gov for the child and adult core sets that define the denominator measurement period for each measure based on core set specifications. So if your state adhered to core set specifications and time frames in calculating a measure, you can open that table and look at the first entry for each measure in the denominator column. And that'll give you what we expect to see if you adhere to core set specifications. Next slide. So this slide, again, is walking through an example of how the denominator measurement period can be identified for one measure. So this takes the medication management for people with asthma measure in the child core set, and it walks through how you identify your denominator population as individuals who had prescriptions that started during calendar year 2016. That's your denominator period. But then, to make sure that the individuals have persistent asthma, you look back to calendar year 2015. And so in this example, even though you review data for 2015 to calculate the measure, the denominator is based on the prescriptions that started during 2016. So that's the denominator measurement period, and that's the approach that's used for all the measures. Next slide, please. So now we just want to make sure you had a couple of resources if at any point you would like technical assistance with reporting. Next slide, please. So here are two email addresses to hang on to as you're working on core set reporting. The first is the email to the TA mailbox, and you can send us any questions you have about calculating, reporting, or using the core set measures, including what to do if you aren't sure how your state's data should be reported or your state's population should be reported in MACPRO. The second email is to the MACPRO help desk, and they can help you with any technical issues with MACPRO, such as access or issues with the site not functioning. Those of us on the TA team are happy to help figure out the best way to report your state's data into MACPRO, but we only have read access to your data, and we can't help with some of the technical pieces of the site. And again, if you're not sure who to email, there's no wrong door. We can help make sure you get connected to the right person to help you.
The MACPRO Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MACPRO assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.